Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Today's episode looks to shine a light on women's sexual and reproductive health, especially one of the family planning methods known as self-inject and self-care. For some people who are familiar with other methods of contraception, either traditional or modern, this would make an interesting conversation for you as you get to know the benefits, advantages of this particular family planning method and its role to ensure women take better charge of their reproductive life with or without the help of healthcare professionals. I have with me here Dr. Anthony Nwala, who is a public health expert that is going to shed more light through his experience as a public health expert and in line with the use of this particular family planning method. Welcome to the program, Doc.
Thank you very much.
So we're talking about contraceptive self-care and self-injection for a layman who does not even understand what family planning is in the first place before talking about a particular method. I'd like for you to, as a backgrounder, explain to us what this whole family planning is before we delve into the methods.
Self-care is a concept, and this concept came up because, as you rightly know, Aisha, the health indices in our country are not very wonderful, and the Federal Ministry of Health, the federal government, everybody is putting hands together to see how we can change these health indices. For instance, maternal mortality ratio in this country today is still at 712 for every 100,000 live births. This, in the last NDHS survey. That's huge. That's like a Boeing 747 carrying 700 and something women and crashing like every other week. Let's assume it takes about a week in Nigeria to have 100,000 live births, which of course that could be much, much less, but just so that we don't exaggerate. So the health indices are poor, and it calls for concern, and everybody, most stakeholders are joining hands together to see how do we change this tide. And one of the vehicles that every one of us in the public health space in Nigeria and the health system in Nigeria have identified, one major vehicle that we've identified that will help change this, these bad indices is universal health coverage. Now, everywhere today we are talking about UHC, universal health coverage. How can we make sure that health is covered universally, not leaving anyone behind, right? And the major vehicle also to achieve universal health coverage is self-care. So that's where I'm going. And that's why self-care is a very important, concept going on today. Self-care simply means being able to empower individuals and communities to be major stakeholders in the management of their health. So it's very important not to mix it up with self-medication, right? Self-care is a concept, and when you're a stakeholder in the management of your health, then you could be taught to, let me just do something as simple as do a pregnancy test at home. That is self-care. Do you understand that? So, having said that, again, self-care, bringing it down also must involve, some self-care products, self-care management, self-care, activities. And so we identified one self-care product that can help to revolutionize self-care in Nigeria. And we started this in the year 2020, and like you rightly said, you can see the rise, the awareness that has been created of self-care. And that product is what we call the DMPA subcute, DMPA-SC. Now, DMPA-SC is it's a contraceptive method, an injectable kind of contraceptive, which the woman can administer on herself in the confine and privacy of of her room or house, at home. A lot of people don't understand family. Now, family planning simply means the ability of an individual, again, or a couple, the ability to decide for themselves, be empowered enough to decide for themselves how many children they want to have, when they want to have those children, what are the intervals they want to have those children. Do you understand that? So when not, they don't want to have those children, so you empower people, and then there are different methods that suits everyone, every religion, every tribe. There is a family planning method that suits everyone. You understand? So that's what family planning is. Of course, modern methods, right? Modern contraceptive methods. So that's about the concept, breaking down those concepts. So going back to the self-inject. So like I already said, it's a hormonal method, it's a product, it's a hormonal product that actually has been refined, so much so that it's been refined and packaged in what we call a uniject, right? So much so that a woman can, in the confine of her bedroom, after being trained, of course, following the laid down guidelines, in the confine of her bedroom, administer that method on herself.
Now, I'd like for us to explore the benefits of this particular method to women. What are the benefits available for women who are expected to use this particular contraceptive or family planning method?
Beautiful. So I don't even know, it's a whole myriad of benefits. Let's even start from the method, the product itself. The product has been refined. It contains, instead of the original 150 milligram of depomedoxyprogesterone, which is the active ingredient, it contains only 104 milligrams of that active ingredient. So you can see, a significant reduction in the quantity while remaining still very effective. And you can administer this into the subcut. There are so many places on the woman's body where you can administer this. And to allay I'm seeing your face, to allay your face, there are a lot of people take insulin at home who are diabetics. Yes, diabetic type 1 insulin. A lot of people check their blood sugar every day, and those are also some forms of self-care, and that's exactly what this self-inject looks like, right? Very tiny needle, not painful. A woman administers herself at home, and then let's look at the benefits. Well, we've been recorded a large reduction in side effects of every hormonal product. Could have side effects. Of course, side effects is not for everyone. Some may have, some may not have. But even those who will have side effects from this product is quite largely reduced. The other thing, look at cost. The cost of going to the health facility. Now, the protocol that is in use in Nigeria, ratified by the Federal Ministry of Health, says that once a woman is trained and she's deemed competent, to inject herself, she can be given some to take home. And this injection, contraceptive method lasts for 3 months, 13 weeks. So if you have 4 of it, you are covered for a year. And this is a year where you would have been going back to the provider in the hospital to get injected. So the benefit of cost, reduced cost from transportation. The benefit, a lot of women are not contracepting today simply because they are not sure their privacy will be respected. Privacy and confidentiality. A woman who can do this at home, will do it in her privacy and ensure that confidentiality, right? And then there are so many other benefits, health benefits. Some of these hormonal products prevent from certain types of cancer, like ovarian cancer. This is well researched and studied. And then there are so many benefits, Aisha, but that's just to mention but a few. The reduction in cost, the issue of privacy and confidentiality, the issue of reduced side effects, and even the empowering a woman, the feeling, the perception that you can take your health into your hands, right?
Okay, so you've spoken so beautifully about this particular product or method, but then how is it different from others? Because I'm aware when people approach a clinic, especially for reproductive health concerns, either a gynecologist or an obstetrician is always going to say this is a method that is suitable for you and this is not suitable for you. But then this particular method is on the table now. How is this now different from others? There's been a plethora of other methods. If we're exploring the traditional, we're talking about the other modern methods. So how is this different from other methods?
Beautiful. But before I answer your question, I need to correct an impression. When a woman goes to the clinic for contraception, no provider has the right to prescribe a method for the woman, right? So there is a process, counseling. You counsel the woman, you present all the available choices, and then there is opportunity for medical eligibility criteria before the woman makes an informed choice. Then you as the provider will now be able to say, yes, this choice you've made is suitable after you've done a medical eligibility criteria process, is suitable for you or not before administering. But I need to put that out there so that women don't think that you just go and they will say take paracetamol or take Panadol, No, it's not like that with contraceptives. Now, the Depo DMPA-SC, as we call it, is not a new product, surprisingly, right? We've had, and the most popular type of contraceptive in Nigeria today, especially with northern women, is the injectable contraceptive, which some call the Depo-Provera. It's called Depo. Some call it just Depo-Provera. It's injectable that you go to the facility and the provider will inject you every 3 months, right? Every 13 weeks. Now, that injectable Depo-Provera contains depomedroxyprogesterone acetate, 150 milligrams. Now, this self-inject we are talking about contains exactly the same ingredient, depomedroxyprogesterone acetate, that's the DMPA, but it's now given subcutaneous. The other one is given intramuscularly. So it's not a new product. It's the same product. But now how is it different from the injectable IM? First, like I said, the quantity of the active ingredients has been researched and refined and reduced, right? Especially because of the route of administration. You don't need as much as 150 to be able to give this effectively into the subcutaneous layer, just under the skin, right? Could be at the abdomen or anywhere under the skin where you have a deposit of fat. But of course there are prescribed places. So this has been reduced because you don't even need all that 150. The other 150 because we are going intramuscularly. That's one difference. Another difference is because it's going under the skin, the needle, like I said, it has been formulated into a uniject. The needle is tiny, so tiny, just like an insulin injection needle that you can just, one can inject it. So there is no pain. The pain is reduced because the needle is reduced and it's tiny. There is no pain, there are no fears, reduced side effects. So that's the difference. And this one, the injectable, for instance, the Depo IM, you have to have a syringe, you have to have a needle, cotton wool swab, all those things together to give an injection, right? This one comes in what we call a uniject, pre-packaged. So you just do the activation, what we call the activation, remove the needle cap, give yourself, and off you go. You understand? So those are the differences. And then, of course, there are all other type of methods, but I just picked the difference between the DMPA-SC and the DMPA-IM. And then, but as an injectable method is different from different other methods, like, there are the implants, the intrauterine devices, the tablets, the pills, you understand? So those are different types of injectables.
Thank you so much. We'll go on a quick break now, and when we return, Dr. Anthony Nwala will still be here to talk about other family planning methods and also this particular self-inject and self-care family planning method that we've been talking about. We're going to be accessing, its acceptability in regions and parts of the country. Do stay with us. We'll be right back. Welcome back. If you're just joining in, this is Healthy Living on Trust Television, and I'm Aisha Salihu. I have with me Dr. Anthony Nwala, who is a public health practitioner, and we've been talking greatly and much about family planning methods. What are the likely side effects? Perhaps the risk factors associated with this method.
Okay. So I'm happy you said in your own words that side effect is individualized, right? So what we say is that side effects are transient, and it's not everybody that will experience a side effect. Some will experience, some will never experience a side effect using the same method, right? And they are transient, which means they go away. You don't need any intervention when you are dealing with side effects. They go away on their own, right? Now, let's bring it down. Hormonal methods, because the DMPS is a hormonal method. Hormonal methods, if there is going to be a side effect from a hormonal method, the most likely side effect will be what we call bleed changes, right? So bleed changes, I need you to pay attention here because there's a lot of misconception around the side effects. So bleed changes means that there is a change in the menstrual cycle of the woman taking this method. Now, this change could be more, blood, more quantity, could be less quantity, could be absence of menses, right, completely, could be irregularity, what we call spotting, right, when instead of once at that appointed time, you might see something in between. So those are if there will ever be any side effect, those are the major bleed changes, different types of changes with bleeding. But like I said, side effects are transient. They don't last max. I mean, well, again, it depends on the individual, but some people feel side effects. The first 1 week is gone, some in the first 1 month, some don't feel it at all. And again, the next one is, like I said, could be no menses at all. So those are bleed changes.
How acceptable do you think this method is?
Some of the issues, socio-cultural issues, of course, religious, economic, and all that. However, for the self-inject, right, when we launched the DISC project, DISC is Delivering Innovations in Self-Care, we had, we are still running our initial surveys and researches, but we had thought that this method of self-inject will be more popular to women in urban areas or to women who are career women, who are educated and all that. But when we started this project and extolled some of these benefits of this particular method I told you about, we found out that a lot, even in the rural areas, a lot of women, there is a huge percentage of acceptability of this method. And I think what has changed is not just the fact that we're able to bring out the benefits of the method, but I think support, community support, spousal support, and how you enter the community has helped. And then when you see something that is beneficial, of course nobody will reject it. So in as much as we are still struggling with some level of resistance, if I'll call it that, definitely is there, but we are seeing a huge uptake, a huge increase in uptake. And this resistance comes in different forms, right? First of all, misconceptions, myths and misconceptions. There are a lot of stories out there about family planning. We've heard so many things, how it makes women grow fat, or how if you take it, you will not have a child again, and it causes infertility. Those are all myths, especially, with the modern contraceptive methods, these are all myths and misconceptions. So we try to address those myths and misconceptions. And we do that by, making available information, comprehensible and comprehensive information. Not just comprehensive, but we ensure that the information are both comprehensive and comprehensible, right?
So how do you think men should be more supportive to their women, their wives, their spouses, in line with delivering this family planning method?
It has to come, it's multifaceted, right? And why do I say so? First of all, again, information. One of the major reasons men don't support their spouses for contraception is lack of information, myths, and misconceptions. I've heard a man say, if I allow her to take a modern method, she will become promiscuous. How do you relate that? There is no way to a woman who wants to be promiscuous, whether she takes a family planning method or not, will be promiscuous, right? So it takes time to get these logical, statements across to especially the men. If I want to manage a woman, get her to contracept, and let's assume that woman is one of those that will be prone to side effects. If I explain all the side effects, tell her that this will not last more than a week and all that, and so on and so forth, and I get the woman to take up a method. If she takes that method and gets home and she starts bleeding, that woman will not have the expertise I have to explain to the spouse that this is nothing. We have seen men with machete and cutlass going to facilities to look for the provider that did this to their wives, whereas eventually nothing was done to the wife. Do you understand? So, but imagine if I get a man rather, and I give him all the information and I tell him, look, this is what could be expected. If you see this, don't worry yourself. Unless it gets out of hand, then you can call or come back. If that starts happening to the woman, what do you expect will happen? The man will say, why are you worried? Isn't that what they explained to us? You know that this is not a problem. So that's just to give you, put it down that you cannot underscore male involvement in family planning. Family planning is not just for women. Family planning is a decision that does not depend on any other person. We must get that clear. You are a woman, you are supposed to be in charge of your health, your body. You must have that empowerment, enough information to be able to say, this is what I want and this is what I do not want. So what we are saying here is not that the man must take that decision for the woman. No. What we are saying is, if you have taken that decision, you will do better if you have a husband who also have information. You will do much better if you have a husband who is supportive. That's what we are saying.
What are your final words to women out there who are looking to take on this particular method?
Yeah. So I would say that there is a method for every woman, irrespective of tribe, religion, whatever. There is a method, a suitable method for every individual, including men, right? And we must know that. But now, technology has even gone a bit further to, expand the choices. And this is a choice coming with so much benefits, a choice coming with ability to maintain your privacy and confidentiality, ability to save costs. You don't have to go to the hospital. I didn't even tell you the benefits for providers. Sometimes you go to a hospital and you see a crowd of people waiting just to be injected. And you won't allow somebody who has malaria or who has a bigger problem to go before you, because you also have places to go. So you see people who need attention of the provider waiting for just people who have come to take injection. So that reduces that burden on the facility, reduces burnout for the providers. We know we just talked about the benefit for the client. So a product that have this benefit that will definitely impact positively on our health system.
According to experts, the DMPSA is a safe and effective birth control method. For comments, contributions, and suggestions on these episodes, do well to follow and subscribe to all of our social media platforms. Join us again for another episode of Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for watching.